Your doctor handed you that prescription and said, take 1 tablet daily. And you have been doing exactly that, faithfully, every morning with breakfast or coffee or whatever has become part of your routine. But here is what Dr. Clara Hoffmann wishes more patients were told. The time you take your blood pressure medication, what you take it with, and what you do when you miss it can either protect your heart during the most dangerous hours of the day or leave you exposed exactly when your body needs help the most. And for many adults over 60, that mistake is happening every single morning. There are 5 timing mistakes people on blood pressure medication make every day. Some are obvious, some are surprisingly dangerous. But the number one mistake, the one hiding inside the routine most people think is the safest, maybe the one putting the most strain on your heart. Stay with me, because if you take blood pressure medication, this may change what you do starting tonight. I'm Dr. Clara Hoffmann. I've spent years helping patients understand what their prescriptions are really doing inside the body, and more importantly, what those prescription labels often fail to explain. Because take once daily sounds simple, but your blood pressure is not simple. It does not stay flat all day. It follows a biological rhythm. During sleep, blood pressure usually falls. Then in the early morning hours, as your body prepares to wake, stress hormones rise, the nervous system activates, blood vessels tighten, and blood pressure begins to climb. That early morning rise matters more than most people realize. It is one of the most vulnerable cardiovascular windows in a 24-hour day, especially after 60, when arteries are stiffer, recovery is slower, and the consequences of a surge can be much more serious. Before we go further, I want to hear from you. How old are you, and were you told to take your blood pressure medication in the morning or at bedtime? And if you have ever taken it with coffee or doubled a dose after forgetting one, stay with me especially closely because you are far from alone. Let's start with timing mistake number 5. Many people assume their morning coffee is harmless. For most healthy adults, coffee is just a routine. But if you take a beta blocker, medications such as metoprolol, atenolol, or carvedilol, that cup of coffee may be working against what your medication is trying to do. Here is why. Caffeine stimulates the body. It can raise blood pressure temporarily, increase alertness, and trigger a rise in stress hormones. Beta blockers are designed to blunt that stimulation. They reduce the heart's workload by slowing heart rate and dampening the effect of adrenaline. So when you swallow your beta blocker and chase it with coffee, your cardiovascular system may receive mixed signals at the exact same time. That does not mean the medication suddenly stops working. It means you may be layering a stimulant on top of a drug intended to calm the system down. In a clinical study looking at coffee after beta blocker treatment, coffee still raised blood pressure and catecholamine levels even in people pre-treated with metoprolol. In plain English, the coffee effect was still there. That is why some patients say, I take my pill every morning, so why do I still feel my heart racing after breakfast? It may not be anxiety, it may be timing. If you take a beta blocker, give your medication some space before your first coffee. Even a modest gap can make your routine more predictable. A simple rule is this: take your pill with water first and delay coffee instead of taking them together. That one small change may reduce the chaos inside your morning routine. Now, timing mistake number 4. This one hides in the refrigerator, not the medicine cabinet. Grapefruit. If you take certain calcium channel blockers, grapefruit can interfere with how your medication is processed. And the dangerous part is that many people think of grapefruit as a healthy food, so it never even occurs to them that it might belong on a medication warning list. Here is what is happening. Your digestive system contains enzymes that help regulate how much of a drug enters the bloodstream. Grapefruit can interfere with one of the most important of those pathways, CYP3A4. When that pathway is blocked, some medications can reach higher levels in the blood than intended. Not all blood pressure medications are affected equally. But among calcium channel blockers, the interaction is real, and for some drugs, it is much more pronounced than patients realize. Phenolidipine is one of the classic examples, and even with amlodipine, studies have shown grapefruit juice can increase drug exposure. Now think about what that means in an older adult. A medication designed to relax blood vessels may become more potent than expected. Blood pressure may drop more than planned. And what follows is not always dramatic at first. Sometimes it starts as lightheadedness, a wave of weakness, a little wobble when standing up from the kitchen table. That is exactly how dangerous medication interactions often begin, quietly. If you take a calcium channel blocker, do not guess. Do not assume that because it is fruit, it is safe. Ask your pharmacist specifically whether grapefruit is an interaction concern with your exact prescription. That question takes 10 seconds. It may prevent a frightening drop in blood pressure. Timing mistake number 3 is one of the most underestimated mistakes in adults over 70. Taking a diuretic too late in the day. Water pills lower blood pressure by helping the body get rid of excess salt and fluid. The basic idea is simple. Less fluid in the system means less pressure against the walls of the blood vessels. The problem is not the medication. The problem is the clock. If you take a diuretic in the late afternoon or evening, the drug may do exactly what it is supposed to do right in the middle of the night. Your bladder fills, you wake up, you stand up quickly in the dark, your blood pressure shifts with position, your balance is not what it was 20 years ago, and now a routine trip to the bathroom becomes a fall risk. This is not a small issue. A recent systematic review found that older adults taking diuretics had a significantly higher risk of falls compared with those not taking them. That does not mean nobody should take diuretics. Many people need them and benefit greatly from them. It means timing matters because nighttime urgency and blood pressure shifts can create a dangerous combination. This is especially true in people who already feel a little unsteady when they stand. If your water pill is prescribed once daily, the safest habit is usually to take it earlier in the day, not with dinner, not before bed, and not whenever you happen to remember it at night. And if you are taking it twice daily, your second dose should not be drifting into the evening without medical guidance. Some patients think the inconvenience is just poor sleep. It is not just poor sleep. Sometimes it is a fractured routine. Sometimes it is a fractured hip. Sometimes it is the beginning of a decline that never fully reverses. That is why this timing mistake deserves much more respect than it gets. If this kind of information is already making you rethink your routine, then you are exactly who this message is for. Because so many people are taking medication correctly on paper, but not safely in real life. Now let's move to timing mistake number 2. This one happens after a mistake and then becomes a bigger one. You forget your pill. Maybe you were rushing, maybe you were out of the house, maybe you looked at the bottle at 9 p.m. and thought, I missed it this morning, I'll just take 2 tomorrow, or I'll double up now and get back on track. This is one of the most common medication errors in blood pressure treatment, and it is one of the most dangerous because blood pressure drugs are not all interchangeable, and the body does not treat a double dose like a harmless correction. For some medications, taking double can cause a sharp fall in blood pressure, dizziness, fainting, or worse. For others, the problem is not taking too much at once, but skipping so often that the medication never gives you the coverage it was designed to provide. There is also another version of this mistake that happens quietly. A person prescribed a twice-daily medication starts taking it once a day instead because it is easier to remember. They do not tell their doctor. Their readings look not terrible at a few appointments, so nobody catches it. Meanwhile, the protection they were supposed to have across the full day is only partial. This is how people end up feeling confused. I'm taking my medication, so why is my blood pressure still unpredictable? Because consistency matters just as much as the pill itself. General missed dose guidance is actually very clear. Do not take a double dose to make up for a forgotten one unless you were specifically told to do so by your prescriber. That sentence alone should be printed larger on every prescription bottle. If you forget a dose, the safest next step depends on the exact medication and how close you are to the next scheduled dose. But just take 2 is not a strategy. It is a gamble. If this is a mistake you have made before, you are not irresponsible. You are human. But from this point on, the rule should be simple. When in doubt, do not improvise. Now we have arrived at number 1. And this is the mistake most people never question because it sounds so normal, so familiar, and so medically official that they assume it must be correct. Taking all blood pressure medication in the morning simply because that is the default. For decades, morning dosing became the standard advice for millions of people. It fit daily routines. It was easier to remember. It sounded neat and practical, but neat and practical are not always the same thing as biologically ideal. Remember what I said earlier. Your blood pressure follows a circadian rhythm. In many people, it drops during sleep and rises before waking. That pre-waking and early morning period is when the cardiovascular system may be under the greatest strain. Blood vessels are tightening, hormones are rising, the heart is preparing for activity before your feet even touch the floor. Now ask yourself a very simple question. If your greatest vulnerability is in the early morning, when do you want your medication to be giving you its strongest protection? This is where the conversation around bedtime dosing became so important. One major study, the Hygia chronotherapy trial, followed more than 19,000 adults with hypertension, and reported substantially lower cardiovascular risk in those assigned to bedtime dosing. That result sparked enormous attention because if timing alone could change outcomes that much, it would force medicine to rethink one of its most routine instructions. But the story did not end there. A later large UK trial, the TIME study, found no significant difference in major cardiovascular outcomes between morning and evening dosing. In other words, the science is not as settled or as dramatic as many viral headlines make it sound. And this is exactly where many patients get misled. The real answer is not that everyone should switch to bedtime tonight. The real answer is that one-size-fits-all timing may be too simplistic. Some patients may benefit from evening dosing, especially when the goal is better overnight and early morning blood pressure control. Other patients may do perfectly well in the morning. Some may experience dizziness if taken at night. Others may have patterns that only become visible on 24-hour ambulatory monitoring. That is the part patients almost never hear. Not all controlled blood pressure is truly controlled at the right time of day. You can have acceptable readings in the clinic and still have a risky morning surge at home before breakfast. That is why the most important question is not, what time does everyone take it? The real question is, what time gives my body the best protection? If your blood pressure medication is strongest at the wrong hours and weakest at the wrong hours, then technically you are taking the right pill in the wrong rhythm. And for some people, that may be the most dangerous timing mistake of all. So what should you do with this information? Do not stop your medication. Do not move it around randomly. Do not turn a YouTube video into a personal prescription. Instead, bring one smart question to your next appointment with Dr. Clara Hoffmann. Ask this: is the time I take my blood pressure medication actually the best time for my blood pressure pattern? And then ask a second question that may be even more important. Would 24-hour ambulatory blood pressure monitoring tell us whether I have a morning surge or a nighttime pattern that changes the best dosing time for me? That is how you personalize treatment, not by guessing. By matching the medication to the rhythm of the body it is supposed to protect. And I want to say one more thing directly to you. If you have been taking your medication for years and nobody ever explained any of this, that does not mean you failed. It means modern medicine is often very good at prescribing and not always good enough at teaching. A prescription is not just a pill. It is timing, it is absorption, it is interactions, it is routine, it is what you drink with it, what you forget, what you assume, what nobody thought to ask, and sometimes the biggest danger is not refusing treatment. Sometimes the biggest danger is believing that once daily means the clock does not matter. It does, more than most people were ever told. So here's my question for you. Were you told morning or bedtime? And which of these 5 mistakes surprised you the most? Because your answer may help someone else realize that the problem is not that their medication failed. The problem may be that nobody ever taught them when it works best. I'm Dr. Clara Hoffmann, and this is the conversation that should have happened the day your prescription was written.